Plastic surgery today is no longer just for women. Aesthetic and personal benefits have resulted in a growing interest from men who frequently request liposuction.
Liposuction can really be performed almost anywhere on the body that we have extra fatty deposits. The most common areas are the lower abdomen, upper abdomen, the sides or the flanks, and the lower back. On women, the most common areas are the outer thighs, the inner thighs, the knees. But certainly you can perform liposuction on the neck, you can perform liposuction on the back, the upper back, the mid back, the lower back. You can perform liposuction on the arms. You can even perform liposuction on the lower legs. So so really anywhere you find fat, external fat, you can suction it out. The other thing about liposuction that patients often ask is, well, is this permanent? And yes, fat removal is permanent. Once you remove the fat from that area, you will no longer gain new fat cells in that area. Now, if you perform liposuction and you go out and eat, you're going to gain weight, and you will gain weight in other areas of the body because your body will naturally have to store the fat that you're eating. Now, one of the fastest growing areas of plastic surgery is cosmetic surgery for men. 10, 15 years ago, it really wasn't acceptable for men to have plastic surgery, but more and more today, men are choosing plastic surgery.
I met Mark out in the desert, and we were talking, and he knew that I was an avid athlete and I worked out a lot. But I always had this little area in my stomach that wouldn't go away. So he suggested liposuction, and in the beginning I felt I really didn't want to do anything like this, that if I work out harder or whatever, and he convinced me through the fact of how fat cells are that liposuction is a simple procedure and it's a good idea, and I felt that I could trust him, and I know of his reputation in the field of plastic surgery, and that's why I decided to go ahead and have the procedure. I had a consultation with him, and then I decided to go ahead to have the procedure. I had it about a week later. I recovered in a matter of a few days. The first day I was a little bit sore, like he explained to me. By the third or fourth day, I had no problems at all, and I was on my road to recovery. And within a few months, I felt great, and I no longer have this area where I have this little bit of fat. Recovery was no problem. He explained the amount of pain I would be in. He prescribed some pain medication for me. I took it for a day or two and then no longer really needed it, and it wasn't really a big problem. I think liposuction is for people that are basically in pretty good shape. They're not for people that are totally obese. I didn't expect a lot of results initially because of the swelling, and through working out, my body just seemed to feel better, and now I'm down to a 33-inch waist again.
There are many things today that make liposuction better than it was just 10 years ago. The first is that we use very tiny cannulas, such as these. These cannulas are very thin. Traditional cannulas were huge. These are very thin and small, and so we can get much better contouring results, get rid of the rippling and irregularities that were associated with the larger cannulas. The second thing that we do today is we use a solution called tumescent solution, which is a solution that we put underneath the skin, which blows up the skin and helps magnify the area that we're going to suction. And it also helps control the bleeding and also helps control the discomfort the patient has. So tumescent solution, smaller cannulas have really improved liposuction. In addition, there's a new form of liposuction called ultrasonic liposuction, where we can actually liquefy the fat using ultrasonic waves. So all of these three modalities have helped to make liposuction better than it was just 10 years ago.